So we're worried that this puts women at grave risk.
This is new times.
A new business planning to open in the city sparks harsh criticism, while others see it as a win for women's rights and health care. Good evening once again. I'm Kim Holden.
And I'm Shelley Brown. A new abortion clinic plans to open in New Orleans East.
But as Amanda Roberts reports, with the clinic comes a lot of mixed reaction.
There are no waiting rooms full of patients yet, only a sign outside the future clinic. Dr. Rashonda Dean purchased the building on Crowder Boulevard in January to be the Dean's Health Care for Women for $175,000. The Louisiana Department of Health says the clinic has submitted an application to be licensed as an abortion clinic, though the application is currently under review. It was this sign, though, that originally caught the attention of the ProLife Group, Louisiana Right to Life.
New Orleans East needs more health care, but not the violence of abortion, and that's what we are very concerned about.
Alex Sagers with the group says they've started a petition against the clinic, fearful it will not only take advantage of those in Gentilly and New Orleans East areas, but also because they're against the service the clinic will offer.
Abortion takes a human life. Abortion is violence. And if New Orleans in general needs more peace and more health care, but abortion, of course, just means more violence and is not a safe alternative for women going through a crisis pregnancy.
But those living in the area say there's a desperate need for business and resources.
We need so many things out here.
Longtime resident Roger Harris recognizes the sensitivity of the subject.
This is new times, and new times take on different measures. And God bless those that have differences one way or the other.
But as a new grandfather, Harris says he can see both sides of the argument.
There's certain things, there's rape and stuff like that, that maybe they didn't want the child, or it was too traumatic for them at that time to want to put up with a baby that's coming into this world that they would never know who the father is. On the other side of the coin, it's hard for me to think that someone's gonna take someone's life.
And in his eyes, it's coming together as a neighborhood that's more important.
That's a hard call. That's a hard call.
Dr. Rashonda Dean, the doctor over the practice, sent me a statement that says in part she believes women have the freedom of choice, and it's the clinic's goal to treat all patients with respectful, safe, quality health care. She says there's no date set on when they plan to open. Kim?